It's very important the human society have multiple choices. We already heard about some good news from United States and from UK and also from China, different technologies but being made to use to manufacture and to trial the vaccines. And in China, this vaccine has been shipped to many destinations, which is good, especially developing world. And in the U.S., the new vaccines are more require cold chain transportation, which may be not as suitable for the deployment in the developing world. But the UK vaccine requires no cold chain network transportation and is also more affordable. So, which means that it could also be deployed to the much of the rest of the world. And so, with the safe and effective vaccine, I think the most important thing so far would be financing and the distribution to make it affordable, especially to the vulnerable population worldwide, as well as available, which means that deliverable to many parts of the world, especially the vaccines which can be stored in the regular temperature. That would be very important. I think the human society needs, really the global community need to avoid the mistakes we have been making over the last century. For example, the TB, the tuberculosis vaccine has been available for a century, almost a century. But even until last year, it still cost about 1.4 million lives. It's not being affordable, available to the developing world. So this time with COVID-19, we need more options. We need to solve the financing issue and also the distribution issue.
And Professor, to add to that, China is part of the World Health Organization's COVAX problem. As you mentioned, helping poorer countries with the vaccine, Latin America, we know that there's a partnership with Brazil, Southeast Asia and Africa. Is this a type of medical diplomacy?
Yeah, I agree with that. And the COVAX, which is a partnership with the WHO, it shows an example of global collaboration in manufacturing, finance, and the distribution of the vaccine. And already 180 countries joined this initiative. But I would say there's still a funding gap to implement and to deploy the vaccines to most of the regions in the world. So the significant funding gap need to be filled by international collaboration. For example, U.S., China should work together. And as we know, China has been working with the African countries on the vaccine and deployment of the PPEs. And in previous years, U.S. was also the major funder of the global health initiative. So when both countries can work together, that will solve much of the financing and the distribution issue. And I think now, even in the U.S., people are being able to say the end of the tunnel, there's light there, but still, just yesterday, 3 dark records was reached, the highest number of new cases and the almost 3,000 deaths and more than 100,000 hospitalized.
Well, I got to ask you about that because, you know, there's this dire situation unfolding here in the U.S. with those numbers that you just mentioned and this rush for a vaccine. But if we look inside of China, what does the vaccination timeline look like there? Is it not as dire because China has their COVID numbers more under control?
Yeah, indeed. So for China, I think the special attention should be paid on the essential workers, especially at the border, at the airport, at the train station. Those essential workers are high risk and could be transmitting to the general public. But in the U.S., it's a different story because there's a surging of cases and the supply chain of this of the vaccine is not established because there's a discussion about the funding gap and also the national stockpiles is not being able to match the largest surge ever for this COVID-19 cases. So there's although the national stockpile in the U.S. are not turning down the request from the states, but the states can only receive a portion of the needs. So in both countries, there is a large demand for the testing and also the global distribution of the vaccine will help solve the issue. But in the coming 2 months would be the darkest for many parts of the world, because even if the vaccine can be deployed 2 months or 1 month from now, people need to get 2 shots, and the immune system will respond to those shots after the second dose, which means that the earliest effect could be there after January. So
logistics.
You very much look forward and avoid the unprecedented surge in the coming 2 months.